Hello everyone, welcome to my channel, and my name is Parvez and this is my friend Ajay, and the topic that we are going to discuss today is related to men's sexual health. So there are two things that we are going to discuss today. One is erectile dysfunction and the other one is premature ejaculation. So Ajay, please introduce yourself and let us know that what are the things that we are going to discuss today related to men's sexual health.
Hello everyone, and again welcome to our channel. I've been a wellness coach for over 25 years now. You must be wondering how come 25 years when I look 25-year-old, but it's been 25 years that I've been focusing on men's sexual health and being a wellness coach. And I've done great research in it. I have seen hundreds and thousands of people who've been suffering from sexual health problems, primarily erectile dysfunction and premature ejaculation. And they're suffering. A lot of people have also, you're not going to believe, but a lot of people have also, gone into depression because of this. A lot of people have, thought of committing suicide, thinking that their life is over. And it is very understandable because ideally a man, there are only two things works in man. One is his brain and the second, you know what I'm talking about. So it is very important for you to keep your health, sexual health, at its peak all the time. And if you're suffering from any sort of problems, you should try and get it fixed. That's the reason we wanted to talk to you about it, because we realized that it's been a really big issue. Go ahead, Parvez. Please ask the question.
Yeah, so the first question that I would like to ask you is that how do I actually know that I'm suffering from erectile dysfunction? Are there any signs, any symptoms that a person should know that he should start thinking about on those lines?
That's a very good question. First of all, ideally you would know. There is no way that you would not know that you have erectile dysfunction. आपको बड़ी आसानी से पता लग जाएगा. 3 तरीके के erectile dysfunction होते हैं. पहला जिसमें you're able to attain erection. आपका erection हो रहा है, but at the time at the time of intercourse, the erection doesn't sustain, right? That's the first type of erectile dysfunction, and this is the maximum people suffer from this type of erectile dysfunction, and this type of erectile dysfunction also have some psychological attachment to it as well, which means that things like performance anxiety, right? Whenever you're going on stage, even though whenever you're alone, you're able to speak well, but as soon as you go to a stage, you start to stammer, right? Similarly, in sex, or should I say intercourse, you're able to attain erection otherwise when you're alone, but when you're with your partner, you're able to attain erection, but after a point, the erection goes away, right? This is also a maximum people who suffers from erectile dysfunction suffer from this kind of erectile dysfunction, where they're able to attain erection, but they lose erection as soon as it's time for them to have sex, right? That's one erection. Second type of erectile dysfunction is that you're not able to attain erection at all. There is no erection, it's dead. That probably is the worst, and this could be that people are suffering from erectile dysfunction for over 10 years for them to reach to this stage where they don't have erection at all. And for cases like this, it is very difficult to recover from, right? And then there is a third type of erectile dysfunction which has to do with your physical health, which means that there is some sort of physical deformity in your pelvic or penis health, right? It could be related to your arteries, right? So these are the 3 kind of erectile dysfunction. First, where you are able to erect but not able to sustain erection. Second, where you're not able to erect at all. And third, where you have some physical deformity because of which the erection is not coming. These are the 3 types of erectile dysfunction. Now coming back to your question, that how do we know that we have erectile dysfunction? If you're not able to, out of 10 times you've tried to have sex, if you're not able to attain erection, instantaneously 7 times out of 10, that means you have erectile dysfunction. It is very normal because of performance anxiety that you're not able to attain erection 1 or twice. It happens with everyone. Probably you're drunk, or you're nervous. This is your first time. It happens, right? But if you're not able to attain erection 4 or 5 times out of 10, this means this is the start of erectile dysfunction, and you should treat it before you get to a stage where there is no erection. So yeah, these are the type of.
Okay, now so I know that I have erectile dysfunction. Now how do I go about I want you to tell the audience, how do I go about treating this? Is this some kind of disease that I have, or is this some kind of abnormality? And because this is a taboo subject in our Indian society, so people don't speak to each other, people are not open to each other about this. First of all, I would like to tell all those young people who have these kind of problems, that how they should be open about it first of all, and who they should approach, who they should talk to about this problem, and how to get this problem treated.
That's a very good question, and that probably is the reason why we're making this video, so that we make people aware of this problem, and don't think that this problem is going to be there forever. This is also a problem that you can fix, just like a fever or a headache. You can fix this problem as well, right? It's not your fault that you have this problem, so there is nothing to be ashamed about it. But yes, it's important to know that why is it happening to you, so that you can stop all those things, right? First thing first, as I've mentioned, there are only 2 ways that this can happen to you. One, if there is a problem in your physical penis health, right? Which means, so first thing what we need to understand is, how do we get erection? So how do we get erection? It happens, so whenever you want to have sex and whenever you're aroused, your dick will start to get filled with blood, right? And it all flows through your arteries in your dick, right? Or should I say penis? And as soon as the blood starts to flow, and as soon as there is enough blood, your penis starts to get firmer and sturdy and stiff, right? And that's how you get erected, right? It's simple. There is a blood flow happens, right? And the reason why that blood flow happens is because you're aroused. You're involved in some sort of sexual activity, because of which your brain signals your penis and all that blood flow. So there are arteries and there are veins, right? So how it happens is that in arteries, all the blood goes up, right? And it makes your dick erected, and then through the veins the blood comes out. Whenever you're done with your intercourse, or whenever you're not aroused anymore, the blood will flow out of your penis. Now this is very important to know, that it is important to get erected, but at the same time it is also important to get the blood out of your penis and lose the erection. So both the activities are equally important, right? If you're erected forever, you're going to lose your penis, right? You can't be erected for more than 15-20 minutes. Otherwise, your arteries will start to leak, right? So this is how you get erected, the blood flow, right? Now, as I've mentioned, that the brain sends the signal, right? So the majority of the time, especially in young generation, the reason why they have erectile dysfunction is because they have performance anxiety. In anxiety, the brain is not able to send the signal. As simple as that. And that happens to everyone, not just in sexual intercourse. If you're anxious, then you're not able to do anything, right? Whenever you'll try and write something, your hand will start to shiver. Whenever you'll try and walk, you will not be able to walk. It's as simple as that, right? So if in order for you to check whether your erectile dysfunction is, so in order for you to know whether your erectile dysfunction is because of your anxiety issues or because of your mental issues, or is it because is it because of some sort of physical problem in your penis, which is the arteries are either clogged, the blood is not flowing properly. You need to do proper tests, right? You need to do, so there are certain tests, certain blood tests, and there is a very important test that will tell you whether you have any physical reason or is it mental. That is called penile Doppler test, right? So what happens is, in penile Doppler test, you will go ahead and get an injection in your penis that will erect your penis, and then using an ultrasound machine, we will check your penis and see if the blood is flowing properly or is there any blockage in your arteries. If there is a blockage, it's pretty simple. You have a physical condition. If the blood is flowing absolutely fine, which means you have a psychological problem, because of which you're not able to get erections. So these are the only two ways you will get erections. In both ways, we will be able to fix it. That's the best thing. We can fix both erectile dysfunction, physical and mental, both.
Are there any medication available in the market that someone can go and buy, or do we actually need doctor's prescription to treat these issues? So is there something that you can suggest to our audience that they can go and buy in the market, any over the counter drug that they can go and buy, or do we need to have a doctor's prescription before trying any of these things to themselves?
Very good question. And I must tell you, everyone, even a 10-year-old kid must have heard about Viagra and tadalafil and all that. And these are the prescriptions medication which is killing your sexual health further and further, because it does give you some sort of temporary fix, and it is available over the counter, right, without any doctor's prescription. But I would suggest, do not indulge yourself into any of those over-counter prescription medications. This can be solved very easily with in-house effective solutions which we have, right? First thing first is, if it is a psychological problem, then yes, we would suggest you some sort of prescription medication, which could be tadalafil 0.5 mg or 5 mg. But if it is a physical condition, and let me tell you that majority of the time, especially in men, which is from 30 to 40, it's always a physical condition, especially people who smoke. Especially, I'm just telling you that if you smoke, if you drink, which is obviously everybody does that these days, then 99% of the time it's going to be a physical condition. If it is a physical condition and the blood flow is low, then it is very easy for you to turn that into a normal condition by following few steps that I'm gonna suggest, right? The first thing is, so let's say, for example, I'll ask you a question. If you're, have you ever, felt, if you've been sitting on a chair for 5 or 10 minutes and you felt that your leg have gone to sleep and there is no blood flow there and you're able to move it, right? What do you do to make it go normal? Like, what do you do that so that, the blood starts to flow there again? What do you do? Have you ever faced?
You stand up and you kind of shake your legs and kind of, get the blood flow right.
Correct, exactly. And that's exactly what you need to do to improve your blood flow. There is a reason why the blood flow have gone poor, right? It's because you're smoking, you have a lot of weight, right? Either you're not active or, you don't do exercise, and because of which you start to lose your blood flow in your penis. And the only way to improve it is exercises. Now, it depends that if you're on the initial stage, if you have just started to feel that erection issues, then exercises. Now, the exercises are not just going to the gym and working out. These are called Kegel exercises, or should I say pelvic floor exercises, right? Which will help the blood to flow in your pelvic area, right? And which will help the blood to flow quickly with a lot of force, right? So there are separate Kegel exercises that we're going to discuss about in next videos. But Kegel exercises are simple, right? What you do in Kegel exercises are you're trying to
inform our audience what is Kegel and which part of our body is Kegel and what are the Kegel exercises.
Correct. So your pelvic muscles primarily are Kegel muscles, and for example, whenever you go and urinate, for men specifically, whenever you go and try and urinate, and just go ahead and stop the urination, right? Stop the urine for a minute, right? And wherever you're feeling that stress, whichever muscle you're feeling that stress when you're holding your urine, right, are called Kegel muscles, or also known as pelvic floor muscles, right? When those muscles are weak, your blood flow in your penis will be weak as well. So in order to improve your blood flow, if it is a physical erectile dysfunction, you need to work with those muscles, right? And in order for you to work with those muscles, you need to do Kegel exercises. Go to Google, go to YouTube, wherever you want. I can tell you that, but this is not the environment for us to tell you that. But go to Google, just write Kegel exercises and you'll get all the steps. Do that every day, 3 times a day. No, you're not supposed to do it like once a day. 3 times a day, 15 minutes. 3 times a day. It will take 30 days and your flow will be as good as it was when you were 20-25. Just 30 days, 15 minutes, thrice. It will fix the problem. If only, and I must tell you that people who have been suffering from it for 5 or 10 years and they have not spoken about it, this would not work for them. This is only for people who are just started to feel that erectile dysfunction and they want to get that fixed. This will work for them, right? This is how it will work for them. For people who've been suffering from it for over 5 or 10 years or over a year, then Kegel is a must, right? With Kegel, they would also have to go ahead and take some certain supplements. Now, what are those supplements, right? Why am I talking about supplements here is that, how is the blood flow weak? When your arteries are filled with some, plaque or some sort of cholesterol or something or the other, which is blocking your arteries from blood to flow. And if it is just the initial stage, the exercise will clear that off for you. But if it is not the initial stage, if it's been over a year and you've been suffering for it, and I do understand majority of the people do not look for a solution in the first few months because they think this is temporarily and it'll go away, right? Majority of the people think, oh, they may not be attracted to their woman anymore and it might just come back, but that's not how it is. And if it is over the year, if it is over more than a year, then you need to take some supplement with the exercise, right? What is that supplement? The first supplement that I would suggest, which is safe to use without even a doctor's prescription, and that is called L-arginine, right? L-arginine is the first supplement that I would suggest. What that do is it has nitric oxide in it, right? We genuinely have nitric oxide in our brain and body, but when we don't have enough of it, then we need to take it through supplements. One of the safest supplement is your L-arginine, right? One of the safest, usually, and nobody was aware of this, that L-arginine, what nitric oxide does is nitric oxide gets into your arteries and widen them. So if there is a blockage, the blockage will still be there, but it will widen the artery so that the blood flow will still be normal, and this will fix the problem. But if you don't do Kegel exercise with it, it won't help. It might help, but it won't be as effective as if you also do Kegel exercises. So for people who are initially facing this problem, just do Kegel, don't take L-arginine, right? There's no need, because if you're young, if it is new, don't take L-arginine. If you are more than a year-old problem, if you're facing a problem for more than a year-old, then please go ahead and take L-arginine. It's a 5 mg. I would suggest take it in a powder format. It's available. It's a supplement. It's not a medicine. It's a supplement that even is taken as a pre-workout as well, right? Just a supplement that is taken as a pre-workout, right? You can also take it. But once you take the L-arginine, wait for 5 minutes, do Kegel exercises. That's it. 3 times a day and you're done. This will give you result in 30 days.
So now that we know that what exactly is erectile dysfunction and what are the reasons people face this problem, and how to go ahead and maybe get some get this problem resolved. So I want to just like to know that what are the reasons that people are facing these problems today, and what are the ways or what are the changes that they can make in their lifestyle so that these kind of problems can be avoided. Because sexual life is something that in when you're young, you don't want to be a victim of these kind of problems.
Correct.
So please tell people, everyone who's watching this, that how we can go ahead and have some permanent fix or permanent solution to these kind of problems, and how fast they can go ahead and resolve this if they are suffering from this problem.
Again, very good question, and everybody whosoever is watching this video and have reached to this point, I am about to give them the, as we say it in Hindi, Ramban for this issue. If they start to follow such habits in their personal life, and this is not just for people who are suffering from erectile dysfunction, this is for everyone. Because you may think that you don't have erectile dysfunction, but you may be very close to getting it, right? So if you this could also work as a precaution, and this could also work as a solution for people who are suffering from erectile dysfunction. So first we need to understand is that what are the biggest mistakes that people are making in their lifestyles, because of which they are getting this erectile dysfunction. Their arteries are getting clogged, and one of the very important thing that people are not doing. For men, it's so important to have blood flow, and it's so important to have veins clearly visible in their bodies, and for that they need to work out. There are two kind of workouts that they need to do. One is resistant training, which is running, brisk walking, stretching, some sort of push-up, pull-ups, free weight exercises. It is so important. Even if you're not doing kegel exercises, the reason why we do kegel exercises is because we have to focus on the area, because now we already have erectile dysfunction. But if you are doing normal resistant exercises, which should also include your abs, your core, your pelvic exercises, your normal running, brisk walking, that can help you and prevent you from getting erectile dysfunction any day. But it has to be on a very consistent level, especially when you're 30 and above. It is very important. I shouldn't really put an age to it. Anybody who's at a point where they have reached adolescence, they should go ahead and do exercises. Not just resistant exercises, but also muscle building exercises. For example, weight exercises, right? It is very important. So there is a thing, a hormone in our body called testosterone, and as we grow and as we age, it reduces. The only way to maintain a healthy testosterone level in your body is to work out, do weight training, do resistant training. So continue to work out, continue to run, continue to walk. If you can't run, walk. If you can't walk, then just stretch and do some ab crunches and stretch out. And if you can't run or do anything, just move your legs, up and left and right. Just keep moving. The idea is to keep active, right? Because majority of our people who are working from home and in corporate houses, 90% of people are employed, right? Only 10 or 2% of people who are in businesses and can do what they want. But especially for people who are working in corporates or working from home, if you don't have time to work out or run, then take 10 or 15 minutes of break after an hour or two and walk. That would do the job, right? Try and do 2-3 days of weight training. That will keep your blood flow in your body going healthy, right? That's one thing. Second is, as you were saying, that if you're smoking is the biggest killer, right? I know a lot of people start to smoke because they want to impress girls, right? But what they don't know is that, once they get a girl, and if you continue to smoke, they may not be able to do anything, right? So it is so important for them to quit smoking, because smoking have so many, chemicals throwing into your body that actually starts to create that blockage in the arteries, right? Now, arteries are everywhere, right? It's in your heart, it's in your everywhere in the body, right? Specifically in pelvic area arteries, if they get clogged because of your smoking, you will have erectile dysfunction, and this would be a permanent one. No fix, no exercise will fix it, nothing. Trust me. So if you're smoking, stop right then and there. Very important, right? And we will come up with another video which will help you to understand how can you quit smoking. We will come up with that video very soon, but for now, just stop it. That's the second thing that they should do. The third and the very most important thing is getting a good night's sleep, right? A good night's sleep will restore your all hormonal imbalances and also restore your testosterone level back in your body, and all the hormonal imbalances can be fixed with a good night's sleep. A good night's sleep will also keep you relaxed and calm, and primarily will help you overall in your sexual health. So and you might want to ask that what is a good night's sleep? So a good night's sleep is anywhere between 7 to 8 hours of sleep is a good night's sleep. So a lot of people who don't sleep well also get erectile dysfunctions at some point or the other, because when you don't sleep well, your body start to deteriorate, and your blood flow will also start to fluctuate.
I think this can be another topic for a video, a good night's sleep.
Correct.
Because I think a lot of people today are also facing this sleep problem. They are not able to sleep properly, and because of not sleeping properly and not giving enough rest to the body, there are several other problems that people are facing today due to lack of sleep.
Correct.
So I think we can make one video about good sleep as well. I think this session has been very informative, and we have I hope this has been informative session for the audience, and people have they have some information, some good information about this erectile dysfunction and how to tackle this problem. And we hope to bring more content like this in future and create such educational videos again for people who are facing these kind of difficulty in life, and they can't even discuss this with someone.
Correct.
So thank you so much, Ajay,
Thank you.
for telling people and educating people about this issue. And
I just wanted what we have discussed today is not even the tip of the iceberg, not even 1.01% of what we wanted to tell you guys about erectile dysfunction. This is just a teaser. In our upcoming videos, I'm going to give you a real quick fix. If you have erectile dysfunction, if you just, let's say you're getting married and you're going on a honeymoon and you want a quick fix and you don't want to disappoint your wife, and if you're just met a girl and you don't want to disappoint her, we have a quick fix, a real quick fix that will fix everything in an hour. But it's a temporary fix, but it is a fix, right? Because usually whenever you exercise and do all the lifestyle changes, the effect won't come overnight. It'll take probably a year. But meanwhile, to have a healthy intercourse, we have a quick fix and a lot of other things that we want to talk about, which we will do in our next video whenever we will come up with one.
So thank you so much, guys, for watching our video. I hope you like and subscribe to our channel, and we will try to bring such educational videos for you, so that you can be for your wellness, for your health, because health is wealth. So we will try and bring you more such content in future. Thank you so much.